Pesavento, how was Florida? Great.
Good. We had fun. Legoland is fantastic.
That's awesome.
Did
And
you
your
get
son
out?
loved.
Oh, sorry. Did you get out before it got cold?
Yeah, we flew home. We flew home Tuesday. Monday was a little bit chilly, but it was overall pretty nice. We had one day of rain. Yeah,
Awesome.
it was good.
Apparently Jacksonville got snow
I
yesterday.
heard.
Yeah, the Florida Panhandle's now had more snow than we have had in Omaha. So,
So has Houston.
oh,
Houston got 3 inches. Yes, and we've only had 1 inch in Omaha.
yeah.
Your health for the future. The older you get, the more complications.
Oh, Jody, we just got Alyssa.
Before on G7, doctor's appointments were not.
Oh, Aaron, can you mute people?
Sure.
Well, welcome everybody. We'll get started in just 1 minute.
Let's go
Got lots of people here, so it's exciting.
What are you crunching on, hon?
Yeah. Hopefully, but they called.
All right, we are at the top of the hour. My name is Renee Rafferty. I'm the Senior Vice President of Behavioral Health and Wellness, and I am thrilled to see all of you here. We would love to have your cameras on if possible. I know some wonderful speakers here today, and we're gonna try to create as comfortable as a session as possible. And we have Chanda Chacon here, and she is our CEO, and we're very excited to have many other leaders also talking about the behavioral health and wellness as we go along today, and we'll have some time for a question and answers at the end. So Chanda, I'd like to start off with talking with you about the vision for the Behavioral Health and Wellness Center. I know it's taken a lot of work to get us to where we are here today, and I think it's really powerful to hear your vision of our expansion of services.
Awesome. Thanks, Renee. I also appreciate everyone being here today. We've had some practice in 3 in-persons of these, and so we'll be very slick for you on Zoom. I'm always humbled to talk about this work, and mostly because several of you on the Zoom and several of you who've come to the discovery sessions, when I first got here at Children's more than 4 years ago, I said, we are never going to have inpatient psych. I think, Tony, I see you smiling. I think you might have asked me that question. And I was like, no, we're not doing that. And I just want you to know that I'm demonstrating leadership agility, one of our leadership competencies, by taking advantage of an opportunity that was presented to us. And, for me, what is so amazing about this work is that it's not brand new work for us. It's expanding on work we've been doing for years. And it's really looking at how do we be a part of a bigger continuum of care. And what I love about the Omaha community, the reason I said, no, we're not going to do that work initially is because we had infrastructure in Omaha that had inpatient psych, that had partial hospitalization. And I thought, for us, as we get into this game in a larger way with the community, we should play a role that doesn't exist. And that really was taking, creating that mental health urgent care model and going backward up into schools and with families and community partners and primary care, and that we would then help know where kids would go in the other part of the continuum the community would handle. And, during that time, we had a large donor, the Mental Health Innovation Foundation, led by Ken Stinson, who said to us as a pediatric community, we were all working together, having good dialogue around how do we help get our arms around pediatric and adolescent mental health? We knew we were in a crisis, and this facility was going to be at another hospital location. And he said to us as a group, does this make sense? Like, is this in the right place? And what was so amazing about the community that's engaged in helping with pediatric mental health is that we said it probably isn't. It probably needs to be a children's. And so that agility of being able to make like a game time decision of saying, let's go ahead and put this facility where kids don't have to travel as far between mental health and physical health, really made a lot more sense to providing innovative care and the best care. And, you know, Renee, you ask me often, like, how are we going to know when we're successful? Like, what does that look like? And for me, it would be not saying what I just said, right? That there's a difference in mental health and physical health, that we start talking about overall health for kids. And overall health involves all aspects of health, mental, physical. And that for me is just a continuation of where we've gone with our mission, right? To understand social drivers of health. We've been in that space, and really now to say, you know, how do we create this full continuum? So I feel honored that we are now stepping into this game in a bigger way to help not do it all ourselves, but be the convener of all of the partners who do this across our community.
I think that vision is so inspiring because it speaks to the investment and collaboration and setting up things that are not going to be able to be easily dismantled because there's so much investment from many different players. And that's where I really admire that type of leadership, because I think it will continue to strengthen healthcare. I also want to touch on the fact that not only have you and the executive team really said committed to this expansion of services, it's also been, how do we shift our culture? What does that look like throughout the organization when we talk about whole person care? How is behavioral health a key component to that? Because we know there's science behind how people experience healthcare, what trauma they experience. We all have human conditions and can have behavioral health conditions that maybe not be diagnosed, but they need to be cared for within each of the settings. And so we've worked on things like the Safety and Wellbeing Council as a result of that support, where we're looking at prevention and intervention through a trauma-informed lens. And I just think that is really also impressive, Chanda, that whole person care is something that you have invested in a time when some people might be kind of retracting back from that. Can you just say a little bit about why that's important to you?
Yeah, for me, you know, families come to us as the trusted expert, their trusted advisor, and they shouldn't have to make a decision about where they go based off what their child is experiencing. And I think the more we get comfortable with it's this full continuum of care and understanding that our organization are seeing kids in crisis right now, and where they're in a facility now that while we have done our very best to design rooms and spaces to help those kids in that inpatient setting, we can do better. And I think it's incumbent on us. I don't even think it is incumbent on us to do that work. If not us, who? And that for me, we're the highest acuity pediatric organization in our state and in our region. And it's important for us to have all of those aspects of care so families don't have to make difficult, challenging decisions when they're in a crisis, no matter what their issue is, what that crisis is. We should be the place they come and help get them to the right location, whether it is us or a community partner. And I think what's the most important about this work is that we're not in it alone. No one organization in our community and our region can solve pediatric mental health for kids and families. We must work together. We must all stay in the business of doing this work because it's challenging and hard and deeply ingrained into kids now. And we have to work together to make sure we can really get our arms around the challenge and do the best for kids. So that for me is one of the most important parts of this facility, is that it isn't just about this facility. We play a really critical role, but it's truly about the partnerships, connections we have all across the state to do the very best for kids.
Thank you so much, Shanna. That's a great place to start, just to really ground us in that vision. I want to continue to talk about the vision for the Behavioral Health and Wellness Center, and I'm going to bring Amy Pugsley into the conversation right now. As we are looking at that vision, I think what's really great is a full continuum of care. And if any of you have tried to seek behavioral health care, you know it's challenging and which door to go through, how you do it, and the opportunity to put all of these services under one roof, including primary care, which I think was really great that Chanda brought that into the building as well because it shows that all healthcare is under one roof, really doubling down on that whole person care. Amy, can you speak to the services that are in the building and how this will be different than it currently exists in our state today and actually throughout the nation?
Yeah, absolutely. This is a really exciting project, and I love that we're doing these discovery sessions. And every time I even hear us talking about it, I get more and more excited about the project because, in addition to what I'm supporting and being a part of the team here, I do this nationally, and I think this idea that Chanda, you so eloquently put, and Renee, you're talking about, is having all of these continuum of services and really providing good quality care, whatever that need is, meeting that need for a child and family. And across the nation, we're moving in this direction. And so in addition to not only following the science and learning and implementing those techniques, we also are following best practice. So SAMHSA, back in 2020 had really taken work that had been done across the country around really good crisis care. And they started with the adults because that's where it started, right? And then they moved into pediatric care. How do we care for children and adolescents in crisis? And so when we line up the science and then we line up best practice and then we pull all of these services into one continuum of care, we actually are creating something that's very innovative and first of its kind. Hopefully many more to come, but across the country, we have pieces of this. And when we have fuller continuums, it's usually on the adult side. So it's really exciting that as this building and all of these services develop, we have primary care, which is already being provided in many places in the community, but to be able to have that at the same place that we have hospital services and all of our ancillary services here and specialty clinics, but also that behavioral health service. So we're really caring for that whole person. We'll have crisis assessment centers. So a lot of times people, it was referred to sometimes as assessment center. And, Renee, you and I talked a lot about calling it what it is, making sure that people really understand that what the assessment center is really, it's a crisis assessment, meaning that anyone, any child or adolescent at any age that is experiencing a crisis self-defined by them, not by us, can come and receive services and receive good quality care from experts and have options for a continuum of care, not only for behavioral health services, but for health services, because we're all connected on the same campus. And so the Crisis Assessment Center is really that idea of being able to come in your moment of need and be met with and welcomed into a very welcoming environment where you're immediately accepted. It's okay what you're going through, and we're going to help you through that. And we're going to meet people where they're at and help them along their journey, not tell them what their journey should be. And so this is that 23-hour, 59-minute kind of approach where it's that urgent care and stabilization all in one. And it's really whatever is needed for that kiddo, right? It might be a couple of hours and then go back home with resources and connection to outpatient and other services. It might be that we need to stay a little bit longer and help stabilize. And so because we have built out the continuum, we have the ability to do that. And then the other higher levels of care, in addition to outpatient, of our partial hospitalization and the expansion of what we currently do for our eating disorders program now. So expanding that service, but also adding in mental health substance use partial hospitalization, really meaning that any type of level, service that's needed, we are able to meet, whether it's in that moment, whether it's to help prevent from an inpatient level of care, or they have been an inpatient, they're not quite ready for outpatient, but they don't need to be staying every single night in the hospital, then that partial hospitalization really allows them to be able to do that. And then, of course, our highest level of care, which is the inpatient hospital setting, and being able to expand to 40 beds, 48 total. But, I think everybody's been hearing those numbers. 40 will be what's opening in a ramped up phase, right? So in a phase process in 2026. But being able to provide all of these services on the same campus with the continuity of providers is really exciting and is going to make a significant impact in the families, the children families that we serve right now, but also across the state and the region, because it's just not something that's done. And it'll help stop people from falling through the gaps, not intentionally, just the process of a healthcare system. And we'll be able to help kind of fill in those gaps that are so needed in the community right now.
Yeah, I really love the way you describe how people can receive care and that it's really tailored to the patient and the family. So often, right now, what we have is you go in and you get assessed and diagnosed, and then you wait. You wait for care. And we know that makes kids and families not progress in their healing. In fact, they come to us much sicker. And so we know that having the availability of the right crisis intervention is key. And we talk about it from a place of no wrong door, that when you walk into Children's, we're going to help you figure out where you need to be. And we're also going to provide intervention. For a family that's struggling, a diagnosis is somewhat important, but really what they need is in that moment to be met with that compassion, with that connection, to be able to know that you are in the right place and that we're going to care for you and we're going to give you tools to manage the crisis that you're in right now. And we'll also walk you along the way to the next step. And that's really when we talk about a no wrong door. It really doubles down on the mission and values that we already have present in our culture and brings the state-of-the-art facility there. So some of the call to action that I have for those of you that maybe aren't interested in employment, but are just very excited about the services, is please go out in the community and speak to families and children about not waiting. And that when your kid is struggling and they're not able to go to school, or maybe they're having lots of anger outbursts, or they're struggling with the ability to connect with friends and family, and you feel like it's urgent, and come in. You don't need to wait until it's a full-blown crisis to do that. We certainly will serve you in that as well, but we want you to know that this is a new way of being and that we're going to be able to meet those needs when you have them. And so I think that's a really exciting message over the next year as we open up, is that these services are going to be available in 2026 in January, and we'd love for families to understand the new continuum of care. Amy, can you also speak to us about the design? There's so much that goes to how we feel when we're in a space, and it signals to the community that they are welcome and that this is a place of healing. How have we incorporated that into the design of the building?
Yeah, I think that's one of the most innovative parts of what we're doing here is really setting up, there's a lot of places that have a warm environment or are welcoming or they're safe. But to have all of those pieces where from the moment you walk in the door, you are welcomed, you are greeted in an environment that is warm and welcoming by team members that are warm and welcoming and very accepting with, we're going to help you, whatever that situation is, even if we're not the right place for you at that particular moment, we're still going to welcome you in and we're going to help you get to the right place, right? Because it's really challenging for parents to have a child or adolescent in crisis and then be told that they're at the wrong place. And so we're going to help kind of welcome people in and help them get to where they're needed. But from the moment we walk in, here's a picture of the lobby actually right now. And then when you walk through the building, no matter which unit you're on, we took this lens of nature, mindfulness, calming colors, and really using this trauma-informed lens of what does an environment need to look like and feel like when you're in there. And that's in the waiting room, that's in the hallways, that's on the unit. And it's a really important factor to be able to trust, a parent to trust that they're asking for help, which is a significant, request that's hard to do, but then to trust that we're at the right place and going to kind of hand over our children and adolescents to someone and not be able to be fully in that building, right? If it's an inpatient unit or a crisis unit. And so we have to be able to design and really explain our services and what that looks like. But being able to create this space where, although we have remained, safety is top priority. Everything about this building is safe. It is one of the most secure and safe places that will be on the campus. And we've created it in a way where the environment still welcomes you in. You feel like that you're, able to be calm, or that it's okay that you're not. There's options and services in the units to be able to help self-regulate and use those tools that are being taught to you, with sensory rooms and quiet and comfort rooms and things like that. And so it's really important that it allows our teams to be able to, because the way we've designed it, that they're able to focus on really that connection and engagement. And because we've made safety the top priority, we've been able to kind of remove that as a constant thought of for staff that often happens in behavioral health, right? Are we going to have an escalation? What do we do with high acuity? What if somebody wants to run? Those types of things. Well, when you design a unit to help manage all of those things without you having to do that, then you can focus on, as a team member, you can focus on the person in front of you. You can focus on the engagement and connecting and building relationship and helping work through those things and taking time to de-escalate, because it's a safe environment. There's nothing that can be used to harm and things like that. And so the idea of having that throughout the entire building, no matter what unit we're on or where staff are at, for patients and for staff, we've thought a lot about that as well. Making sure that environment continues for them, that they're not walking into stark white halls and white offices and things like that, but that we all deserve to have a very welcoming environment. It helps us feel better, and it helps us then serve better, which is the goal.
Yeah, and I love too the opportunity to really change how we do design. You're seeing that happen across the nation as there's more focus on behavioral health, is that we're not designing systems to be for the worst case scenario. We're designing them with state-of-the-art safety, and then really layering in that therapeutic approach that allows for healing. And that's new. You've seen a lot of like you described, more stark environments. And so it's very important to know that this has really been research backed and supported, and will be state of the art. People will be coming across the nation to see this incredible building and to be a part of this. Could we talk just a little bit about the team members that we want to bring in? I think for me, one of the things I always also want to message people is that we are so excited to be a part of Children's. Amy and I both have been here. We're kind of newer, but we have watched the excitement and the incredible passion towards behavioral health. This behavioral health team, social work. But what I see is it's actually across the organization. People deeply care about kids and families, and they want to learn and grow. And we're really excited to be a part of that, and wanting to bring in people that are ready to learn and be part of a trauma-informed clinical setting that's going to have state-of-the-art behavioral health practices. So it's really that heart, but that we already have within Children's, but then that curiosity of how do I intervene and help someone and hold space for someone that is really struggling and with their emotions and with how they can be more connected to healing. So I think sharing a little bit, Amy, about your vision too of how are we engaging team members, and who are we looking for that will want to bring into the Behavioral Health and Wellness Center?
Yeah. I think it's really exciting, and I think a lot of people get excited when they hear all the amazing work, and that work's being done differently for behavioral health, right? So again, this is the culture of Children's. It's what drew you here. It's what drew me here. You don't up and leave and move across the country when you're not excited about the organization and the culture as a whole. So it's Children's through and through. It's just adding in this other layer of what's this service that's been out there that that it's kind of like other people take care of that piece, and it's bringing it in and just enveloping in the culture that we already have. But what we want, so we have those people that are here doing that work now, and I think there's a lot of people that are probably interested in behavioral health at some, either currently are working in it or have worked in it in the past and that type of thing. But I think that what we're looking for is people who are really excited about helping children and families across the board, really understanding that that whole person care is so critical to their overall health, and wanting to either be in the trenches doing that day-to-day work, or being an advocate and a champion for that, because the whole spectrum is what we need. And so it's really people that are committed to that, kind of that extension of the current mission, right? Of really making sure that this is part of everything that we do. And then being okay with and actually wanting to welcome people over and over again when they really need that care, so that we don't get tired and frustrated, but we're here to help. What can we do this time? What's going on now? How can we do things better? And having that kind of mindset of we're here to help however many times you need us to be here to help. And having that lens that we're looking through with a really a true focus on trauma-informed care, and wanting to be part of a community, but then also wanting to be able to connect and collaborate with our partners in the community. Because as Chanda said earlier, it's not we're not the end all be all. We can't be everything to everyone. And so, so we need our partners. So we need that collaboration. So we need this variety of people in these different services that are bringing that in, bringing their expertise on the different sides of healthcare into the behavioral health setting as well. And then being able to be that liaison out in the community and connecting us as well, and finding good resources and those types of things. I think what's probably a common question that comes up is what kinds of roles. We oftentimes think of clinical roles, right? So for sure, absolutely 100%, there are those clinical roles, the nurses, the therapists, the providers, both nurse practitioners and psychiatrists. And then in addition to that, we have, the behavioral health tech role. We have peer support and family support roles. We have our access specialists, and then all of our other team members, our dietitian, our occupational therapy, our security team will be embedded as part of our team. They'll be doing things a little bit differently in behavioral health and wellness, and that's a good thing. We're excited about that. And so there's lots of other disciplines and ancillary departments that are being brought in for what's needed when they might not be housed there, but kind of help support us when we need to. So there's not just that clinical team that we're looking for. There's all these other roles that play a part in making this really successful, and a full continuum and a smooth continuum of services between all the healthcare services that include behavioral health.
Sammy, I appreciate that. It's one of the best parts of this is the people that are going to be in the Behavioral Health and Wellness Center. I'd like to transition over to Sabrina Shalley, our Director of Behavioral Health Integration, and Marcy Peterson, our new ACNO. They're going to share a little bit with you about training, some of the work that's gone into preparing for the building to open up. So I'll hand it over to them.
Well, thanks so much, Renee. And it's amazing to see 258 of us on this call. It's so exciting to get the opportunity to talk about this amazing work. And one of the things I can say about that is Marcy and I have worked near or around each other for the entirety of the time I've been at Children's, because she's got more tenure than I do. But it's really been this last 18 months, Marcy, that we have been side by side, Zoom screen to Zoom screen, working on this. And maybe you might want to share some of that with everybody here.
Yeah. So we have the building, and you drive by it every day and you see it rapidly coming together. But that building, it's just a building. It's a structure, but it's really what happened when we started to come together. Like you hear Amy and Renee, they moved here because of Children's and our culture and the great things we're going to do and accomplish. But it brought our people together, and roles like I knew Sabrina. I knew her for years, but I didn't really know Sabrina and her role and the value she brings and what I can do now that I have that full scope. HR has made really well-designed sheets to understand like how we hire so that nobody is left with a vacancy. Security. We've talked through when we call them and we say we need help, but they have no idea of the background behind the reason we need help and how we can communicate better. But sitting together for 18 months, we've really become one team. And bringing a new service line that we haven't done before, that can be a little scary. But Children's is really committed to providing that seamless continuum of care, whether we're in the hospital, the SPC, children's physicians, or that behavioral health and wellness center. We're going to have that core foundation of training, and we've done a lot of work. So this isn't work that just started. Like you've seen that we've added ED psych nurses and ED behavioral health techs. Sabrina, you've been involved in a lot of training to get us up to another level. So can you kind of speak to some of the work that we're doing right now to prepare us?
Yeah, no, thanks, Marcy. I think it's a great thing to call out that while we're talking about this new building and these additional services, that so many of you on this call have been participating in our growing services to kids who have mental health needs for years. So someone at one of these in-person ones came up to me afterwards and they're like, "Oh, you're the suicide lady." And I was like, well, I'm not sure that's exactly the name I would want to go by, but I appreciated that they connected me with a presentation about zero suicide, which is something I'm very passionate about. And many of you have kindly indulged Dr. Vance before his retirement and myself talking about how Children's is growing in those spaces. And one of those ways, regardless of where you are on that continuum that Marcy was just describing, you have been helping us screen our kids ages 11 and older for depression and suicide for quite a while. I see many of my friends and children's physicians on this. You've been screening these kids for over 10 years, but our hospital environment and our specialty environments have really been ramping up over the last couple of years. And I thought, leave it to a social worker to bring data to a meeting, right? I'm sure the people are laughing, but I think it's good to know that we screened last year, because we're just here in January. So for 2024, we screened over 42,000 patients ages 11 and older for depression and suicide. So I'm going to pause and say that number again, 42,000. That's nearly half of the kids we saw all of last year. And when we screened those, almost 11,000 or 19% of them screened positive to be at risk for a mental health condition or suicide. 1,000 of those, so drilling the data down more, are kids that were coming to us for nothing, wasn't a well child check, wasn't to behavioral health, it wasn't coming to the emergency room with suicide ideation. They were literally showing up somewhere to one of our medical teams and we gave the screen they may be even seen for a broken arm or potentially for a cold in urgent care, and they screened positive. So those were 1,000 kids we wouldn't have otherwise been able to identify. And then the most important statistic is over 100 of those kids had active suicide plans, meaning that they were planning to make an attempt on their life. And so that's just a way all of you have already been helping us identify these kids and referring them to the most appropriate level of support. I think it's absolutely critical. Some of the other things we've been doing, Amy mentioned trauma-informed care. Hopefully some of you begun to hear that term because it's a really great way for us to engage with our patients and families when we're meeting them, particularly in a space of behavioral health. Austin, you're kindly up on my screen. And it would be the difference if Austin came in and as opposed to maybe approach we might traditionally take in physical health, where I would say, okay, Austin, what's wrong with you? Why are you here today? Instead, it's saying, hey, Austin, I see you're here today. Can you tell me what's brought you here? What have you gone through? And it gives Austin a chance instead to tell his story of why he is here at Children's, as opposed to us immediately going to a place of injury or error or something like that. So many of you, all the nursing leaders on this call, you've been through that training with us, and we so appreciate it. We've taken it to a huge group of the emergency department team members, and it will be coming to all of you as well. And we're really excited about that because that will help us, Marcy, better serve our patients in this space. And Amy was talking a little bit about all the key people, but I think you've got some great information on that to share as well.
Yeah. And one thing I just want to really reinforce is like Children's is not going to be the one all be all. This building is not going to be where all kids go. We're going to really need to work with our community. And this is an organization-wide initiative. And so part of you being on this call today is to really like learn, be able to speak to what we're doing and what we're opening our doors up to provide service for all care for all kids. And I am very competitive, if you know me. And so I want to be the place. And I think our vision is that, we want to be a resource and use our community partners. We have to have those strong relationships. But what we're striving to be is the place where people to go to learn how to do it best. And so we're taking that science and that evidence and making sure that our practices align with the best care. And so you may see that we're doing things a little different, or we're asking why, and like really pushing a little to change so that we can get to another level to provide that care and that expertise that our kids really deserve. And so, yes, we've talked about the design of the building, but it's also the words we use, how we look at the whole child, and we change our practices. And that can be intimidating and get us out of our comfort zone. The other thing that we're really looking to do is have a waiting list. Like, this is the place to be. They can see the difference that we're making with kids, and everybody wants to join. And so our goal too is to really promote those services, that no wrong door, and they see us working together seamlessly, and that some people may not even have thought about working over in the behavioral health and wellness building. Like, I just did an evaluation today, and they attended a discovery session, and they're like, Marcy, you make it sound so good. Like, I never thought I'd ever do that. And I'm looking at it and I'm like, good for you. Like, I'm glad you took, we're looking at things differently and opening our eyes to different opportunities that we never thought we would do.
I think there's just, and Marcy and I are gonna kindly turn this over to Jen Bretman, and she's gonna be able to tell you exactly, if you are interested in continuing to hear more about the positions, how to do that. But there's one specific voice amongst all of us that are talking with you today that isn't here, and that is our patients and our families. And I think for all of us, wherever we land in the pediatric healthcare continuum, they're the reason we come to work to do what we hope we do best day in and day out. And so some of you might have heard of our program that we've been running for almost 5 years now, the Caring Contacts program. Just real quickly, this is a program where we handwrite notes to patients who have been in our emergency room for suicidal ideation or behaviors. They get these handwritten note cards from their social worker for over a year's period of time. We just recently, if you saw it on My Children, celebrated our 1,000th patient enrolled in the program. And the best statistic of data I will share with you today is that we've had 0 patients in that program die by suicide, which is, in the mental health, behavioral health world, as good as it gets. But what we didn't anticipate when we started writing those cards was that the kids were going to begin to write back to us. So I thought sharing one of those cards might be really special today, since we don't have kids to talk with. So this is one card, and I'll just read a portion of it. But this patient says, I wanted to let you know how much of an impact the cards have, and to know someone I met once cares so deeply for me. I am doing the best I have been since a year ago. I never imagined this much happiness was waiting for me. There have been hard times, but I have been able to overcome them and become better in the end. I can never thank you enough for all you have done in my healing journey. And I wanted to just share that because that was a patient who had one interaction in one area of children's, and that was the impact we were able to have. So when I think about expanding our services across the continuum and more patients like this that we'll be able to help, it is the biggest bucket filler of all. So Jen, Marcy, and I will turn it over to you.
Thank you so much. Yeah, it's always humbling to hear from our patients first, right? So thank you for sharing that. I know we all, if you drive by a Dodge or you're able to have a window view, you see the building going up, and it's hard to believe 2026 actually will be here before we know it. And I'm still working on getting into 2025. We've just kicked off 2025. So, but we are going to start sooner versus later, I guess would be the words. In first quarter, we're going to start our internal recruitment. So I would anticipate we are going to start posting positions internal only in February, March, because we know that we would love to grow and develop our own team. And we also feel like there might be some hidden gems or talent that we are not aware of within our own team. So we want to provide that opportunity first. As we go into second quarter, there'll be some, and that's when we'll identify the team members making the transition to the Behavioral Health and Wellness Center building. With that, we are going to also, let's say MedSurg, someone from MedSurg wants to come over to Behavioral Health and Wellness building. We don't want to take from one and have another department running short. So we're going to go ahead and work on backfilling those positions well before people start transitioning into the new building. In quarter three, we'll start posting for external hiring. We are getting phone calls now and getting a list of people that are interested, but we're like, hold on, we're doing our internal team first. So even if you're not interested in transitioning to the new building, but Omaha is one of the biggest small towns that there is, and you may know someone that is interested in joining Children's, and they'd be a great fit for us, and they'd be a great fit for behavioral health. Let them know that we will be posting externally, but they're going to have to wait. We are prioritizing our internal team first. And then really in quarter four, we're going to start our training and preparation for opening the new building. And then we'll all celebrate when we are fully staffed and ready to go in beginning of 2026. Now, if you have never posted for an internal position, I did want to bring this forward. So all these internal positions are going to be available in Oracle. So that's under the Me tab as you log into Oracle, and you would click on the little tab that says Opportunity Marketplace. So that's what it shows there. Now, I would not expect anyone who's interested in this role to keep going out and checking the internal marketplace. So we're happy to communicate when these positions are available. So there is a QR code. You fill out the interest form, indicate what position you may be interested in, and we will notify you when those positions open up internally. So we're happy to send you when that position is available for you to apply to. So I know that Amy had already touched base on some of the internal positions that are going to be in the facility. I don't know, Amy, can you speak a little bit how it might feel a little different between what we're used to?
Yeah, absolutely. Yeah, I think that's a lot of questions that come up of what is it going to look like, especially if you don't haven't worked in behavioral health, but then also haven't worked in behavioral health the way this is being designed. And it is really this multidisciplinary team with a lot of kind of those ancillary resources coming in to help and support. And so, when we think through crisis assessment center, the inpatient unit, and the partial hospitalization programs in particular, because outpatient, obviously it runs differently than some of these core teams that get put together, is that it's really looking at that multidisciplinary team of a peer, a tech, a nurse, a therapist, nurse practitioner, and kind of that psychiatrist oversight as well, working together on each of those units that are really collaborating and working as a team, including the patient and family in that process, and working towards common goals. And and really that idea that it's a little bit different, right? For a nurse, you know, it's not a hospital setting. And so the nurse's role is a little bit different. There's not IVs, there's not these kind of life-saving medical things that are going on in that area. It's more of a different kind of life-saving, if you will, that we're working on. And so the ratios might look a little bit different, and the staffing pattern looks a little bit different, but it's really this comprehensive approach to helping someone really move through their journey. And so that's really how we help stabilize quickly, but then also help them move through and kind of discharge the least restrictive environment. So it's a different kind of approach. I think therapists, you know, it's different than an outpatient role where you're doing one-on-one sessions or family sessions. It's being a part of a unit and yes, doing those types of sessions with families and individuals, but also doing some group work and being part of that treatment team continually. And then, you know, that peer support role, I think, is new in a lot of ways to children's. And so that is a person with lived experience, and that really brings that lens to the entire team and how to work and connect and engage with the patient and family throughout this process. And then the behavioral health tech role, I think that's a little bit different too. So it's good to know, just so people understand what that looks like, is that it's very engaged and part of a team, but they're not the only person in the room, just like the nurse isn't the only person kind of going in. And the environment, the way it's set up is that like the Crisis Assessment Center, it's really an open environment where recliners are for this crisis stabilization. So everybody's in the same spot. It's a large area, day room area and all of that, but it's not coming in and checking in on people in their rooms. We want children and adolescents to be out of their rooms and engaging in that day room area activities and working through that individual, family, and group work together. And so it's just this different feel. So those roles just look a little bit different than a typical, you know, nurse, like in a or even the social worker or the techs in an emergency room, because those are, you're checking on patients and the environment is set up different and the goal is different, right? And so just something to think about, but we're always happy to answer more and more questions around that because it does come up a lot.
Well, and I'm going to close us out with just having a few words about wellness. Children's is very focused on teen wellness and how we can care for each of you. And that will be very essential for the treatment of our kids in the Behavioral Health and Wellness Center and our parents. And part of what I really truly believe is that we're all in a parallel process. We ask people when they join healthcare to think about their own health and well-being. And that doesn't just stop with your thoughts and what kind of happens from here to here. Your whole body is part of your wellness. And one of the tools that I often will teach my team members is that within 5 feet, we start to link up. Humans naturally want to have the same heart rate. When they're next to each other, they start to co-regulate. And that could be a really good thing. If I'm standing next to Chanda or Amy and either one of them is full of joy and connectedness, and I might be down, that could feel amazing. It also can be difficult if someone's angry and frustrated and in pain. It's important that we stand next to people that are experiencing that, but we also want to really pay attention to what's happening to our own nervous system. And so part of what we teach when we're in the Wellness Center, and also what we can share in any setting, is that just awareness of noticing your heartbeat, being able to take a deep breath, being able to say, wow, they're big emotions in the room. Maybe you say it to yourself internally and you say a kind thing to yourself, like, I've got this. Or you notice that maybe somebody in a meeting is really distressed and you started feeling angry too. You go, oh, wait a minute, is that my feeling or not? That really helps with wellness. And it really fits in with our philosophy in the Behavioral Health and Wellness Center, because we don't want you to think about your wellness at the end of the day. We want you to think about it throughout your shift, checking in and saying, hey, do I need a minute? Do I need to go to that comfort room that's designed for staff to take a breath, to reset their nervous system, to engage? That's part of what we have also at the medical center, where we have those comfort rooms that are designed to help staff do that. And we're going to continue to pay attention to that so that we can use those tools, not just at work. These tools that you'll be learning if you decide to come over to the Behavioral Health Wellness Center, or if you're part of the larger Safety and Wellbeing Council, those are tools that also are supportive of your family systems and when you're interacting in the community. So it's a journey of wellness for all of us. And we're really excited to be part of that. we want to spend some time just answering your questions. So I know we've got a few in here, and I'll just start off with the first one. That Dalton, great question. He's just asking a little bit about, how are we looking at neurodiverse children and how do we address some of those needs? Well, number one is we have created a multisensory environment with the thought that kids experience their senses differently when they're in crisis, but also when they have different types of diagnoses. And so we have the opportunity to decrease stimuli and increase it as well as making sure that we have a beautiful outdoor space where kids can go and reset, get grounded. There will be occupational therapists, as well as we're hoping to have ABA trained occupational therapists, or maybe even therapists as well. So we're focusing on ABA as a term that is designed to help kids manage their behavior. It's specifically related to autism, but it actually helps in other instances. So we're going to care for any kid that's in crisis. Like Amy said, we're not all things to all people, but we are going to be the acute care setting where we can care for crisis, and people come in with different conditions. All right, I will look at the next question. You're welcome to raise your hand as well. Will consideration be given to those who are stabilized in the crisis center, do not require inpatient care, and have access to outpatient therapy without the typical 2 to 3 month wait list? Amy and Sabrina, do you guys want to check in just a little bit about that?
You can go, Sabrina.
Okay, that's fine. When we're in person, it's easier to hand off. I'm like,
yeah.
No, Mindy, thanks so much for that question. And I come from the world you're in, obviously, with care coordination and social work, trying to find those connections. One of the top things we're looking at in outpatient behavioral health is access to care. And that's going to come in many fashions. It's going to come with obviously ensuring our provider team is best capable of serving the kids that are being referred from whether it's the crisis assessment center or you all there in children's physicians. But we're also going to look as diversifying the types of therapeutic support we offer, enhancing bridge services. Not all of our kids who come in crisis are going to need to enter into longitudinal therapeutic relationship. So how can we increase access? Like I said, I would summarize in those two ways of diversifying our options for our patients, and then also ensuring we have the right sized provider workforce. So Amy, I don't know if you want to add to that.
I think the only thing I would add, Sabrina, is that all of that takes a lot of collaboration and coordination and time to work through. And we're going to hit some hiccups along the way. Like we'll get things going and it'll look really great. And then all of a sudden we got some challenge that came up. And so I just want to stress, like, that's why we all work so well together, right? That's the piece of this coordinating. Sabrina and I talk all the time, and we'll continue talking all the time, along with all of the other members of the team, because it's really important to receive that feedback so that we can then do better. So just like we're going to give feedback, we want to receive feedback as well. And then just, we got to be patient and continue to work together as a team.
Yeah, great. It kind of goes along with this next question that Jess has about what kinds of consideration has been given for ancillary services, child life specialists, healing arts, such important aspects of care. I will hand that over to Amy as well. Those are really important aspects, and many more, etc.
Yes, that's a great question. And definitely those are the services that will be looked at, and really we want all of those services to be incorporated at some level. The thing that we have to kind of think through, and what we'll continue to do, is what is the volume? What is the need? And I think there's a difference between, there's going to be some positions that are very integral to everything that we're doing in the day-to-day. And so we need that position very much like housed out of the Behavioral Health and Wellness Center, and like the dietitians for EDP, for example. And then there's others that it'll be a support, just like it is right now in the current campus and situation, where they're housed in a central location, and then they kind of and go where they're needed and when they're needed. And so all of those levels of care are definitely something that's part of this process, things that we're going to be doing. We've talked at high levels with those VPs and department leads. The really getting into the weeds and figuring out all the details of what that looks like, the workflow and all that. That's this year. That's 2025. That's what we're figuring out and getting through all those details. But those higher level conversations have started and started that engagement process so that we can work through that.
Great. The next question is, will there be any positions that will allow remote work, for example, in scheduling? At this time, most of our positions are in person. As we launch the center, we really need, people to be there because they're acute services, but you never know, down the road, we might have remote work. So great question. And then Emily Hollingsworth asked about the Embassy Park office will be moving there. Will this change how children's physician clinics function? Right now, I think Amy's done a great job of sort of talking about the importance of the connection and continuum and working closely together. So those are things we'll still be talking about what that will look like. But I think they'll be moving over and really providing the same types of services that they're providing now. And Austin has a great question. Do we know yet what the leadership structure will look like for these clinical teams? Sure, Amy, would you like to share a little bit about that?
Yes. Yeah. So there'll definitely be, as you see the positions come through, in addition to kind of, my role as the director, we'll have managers for those different units. So a crisis assessment center manager, a partial hospitalization manager, a nurse manager, and an inpatient manager, and then of course the outpatient team and their structure as well. And then within that, those different kind of units. So if it's more of a unit-based structure, then those managers will have clinical supervisors both on the RN side and the therapist side that will then support the therapists, the RNs, the techs, and the peer support. So there is some structure built in, and we very much believe in, like, we have to have a really well trained team that has time to do that reflection and that clinical supervision and be able to work together and all of those things in order to really all of us be working at the top of our scope all the time to provide the best care. And so there is definitely a structure and those team kind of units. The goal is to have somewhat cohesive teams. That's what I've seen to work the best in these types of situations, as I've from my past experience. And so it is the idea that hopefully those core teams, therapists, tech, RN, therapists, that type of thing, are on shifts together, so that you really learn and grow and become a cohesive team that runs really smoothly, whether we're having a very stable day or a very highly acute day. And so that's the goal.
Yeah, and I'll just add one thing to that. I think it's really important to also let people in the community know that this is going to be a great place for training and for licensure. If you're new to the field, this is a place where you're going to come in and you're going to see many different diagnoses. You're going to get to see acute conditions, and you're also going to get fine-tuned skills because of the clinical supervision and the team approach. We're really focusing right now in how do we bring specialized treatment. Those of you who are in the therapy world will know some of these acronyms, some of you may not, but things like EMDR and DBT and CBT and trauma focus. We really are focusing on what is best practice for crisis and stabilization, and that has really evolved over the years. It does not look the same that it does in other settings where we're just maybe doing some talk therapy. We actually really want to help kids learn how to get calmer in their body, or actually really engage in connection and joy. So those are the things we'll be using evidence-based training and making sure that the therapists that come to this building are going to really have a very wide range of training and support to ensure that they grow and really develop a solid skill set. I don't think I see any more questions. Any more out there that you want to raise your hand and jump on? That's fine too. You guys are doing such a great job of engaging. It's impressive with 223 people here. We're really available for questions later too. Send us an email. We are happy to engage, talk things through. Yes, I did respond to that one, I think, but we will have security team members. And like Amy said, they will be part of the clinical team and working closely. They'll have specialized trauma-informed care training. as well. And even their uniforms might look a little bit different because of the type of setting that it is. But we plan to have security on 24/7. We also have specialized de-escalation training that is unique to behavioral health as well, that all the care team members will get. All right. Well, I just thank you all so much for coming. We really appreciate that. Please reach out to our HR partners and ask questions. We're happy to have you here, and we really look forward to the next year of partnering and letting people know about these amazing new services and hopefully decreasing stigma and increasing access to care as a large organization. Thank you.
Bye, everyone.